The spinal cord. What is it? Why is it important? What does it do? And what happens when it's injured? This video will elaborate on all concepts pertaining to the spinal cord that are important for you to know. So just what is the spinal cord? Well, the spinal cord is a major part of the nervous system. The nervous system is a crucial system within the human body and is responsible for all actions and movements, as well as signals that are transmitted throughout the body. The nervous system is split into two systems that work together to allow the body to function properly: the central nervous system and the peripheral nervous system. The central nervous system is made up of the brain and the spinal cord and is responsible for coordinating and transmitting signals, whilst the peripheral nervous system is composed of everything outside of the brain and spinal cord and responsible for movement and actions. The peripheral nervous system is further divided into two nerve categories: somatic nerves and autonomic nerves. Somatic nerves are responsible for the voluntary actions of the sensory or afferent nerves, such as pain receptors, or motor or efferent nerves, which are linked to the skeletal muscle to perform and create movement and function. The autonomic nervous system is responsible for the involuntary actions of the sympathetic system that prepares the body for a state of alertness or the fight or flight response, while the parasympathetic system prepares the body for a state of calmness, performing essential functions such as digestion. The peripheral and central nervous system work together to make up the nervous system. In order for any movement to occur, a message must begin in the brain, travel down the spinal cord to specific nerves, and then will cause a contraction of a muscle, causing movement. To truly understand how this works, it's important to understand how nerves work. So here's a labeled diagram of one. Here you can see the axons, the dendrites, and the cell bodies, all of which are crucial to allow signals to occur. Additionally, there are a few different kinds of nerves with distinct differentiations between them. Neurons that are unipolar contain a single axon that extends from the cell body that then splits into two. Bipolar neurons contain only one cell body that resides between an axon and a dendrite, and a multipolar neuron, the most common nerve type, contains several dendrites with only one axon. So how do these signals work? Essentially, all actions are the result of impulse transmissions. For a synaptic transmission to occur, there are several things that must happen. First, the impulse must reach the synapse of a nerve from the axon. The impulse then stimulates the synaptic vesicles to move to the presynaptic membrane, where they expel neurotransmitter substances into the synaptic cleft. This substance then diffuses across the cleft where it fits into receptor sites on the postsynaptic membrane. An enzyme then clears out the substance from the synaptic cleft, allowing an action potential to be stimulated and cause the impulse to travel down dendrites to perform its desired function. So how does this relate to the spinal cord? Well, the spinal cord contains these nerves. In fact, there are 43 pairs of nerves that belong to the central nervous system, 12 for the brain and 31 for the spinal cord. These nerves are essential to the everyday bodily functions of a person, so they are highly protected by the body by cerebrospinal fluid, several membranes, and vertebrae. Cerebrospinal fluid serves two distinct purposes: to absorb any shock that may be inflicted upon the spinal cord, as well as to transport substances around the body. The vertebrae act as a column to protect the spinal cord from any harm that may come to it, and there are 33 vertebrae in the spinal column, all of which are divided into specific sections. The cervical region is the upper 6 vertebrae. This region is responsible for the movement of the head, chest, neck, shoulders, arms, and hands, as well as the diaphragm. The thoracic region are the next 12 vertebrae directly below this. The thoracic region connects to the intercostal muscles between the ribs, as well as causes movement in the deep back and abdominal muscles. The lumbar region are the next 5 to follow this, which make up the movement of the abdominal wall and parts of the thighs and legs. The sacrum and coccyx are below this, with the sacrum responsible for the muscles of the thighs and buttocks, the skin of the legs and feet, as well as the genital and anal regions. Each section is responsible for different functions as they are connected to different nerves that are specific to their tasks. So what happens if the spinal cord gets injured? Well, despite the best efforts of the body's natural protectors, injuries to the spinal cord do happen. The symptoms and severities of such injuries depend entirely on where the injury occurs on the spinal cord, as this will indicate what function is lost. Typically, most spinal cord injuries happen to males that are between the ages of 19 and 26. Although injuries can be sustained in a plethora of ways, over 50% of all spinal cord injuries are caused by motorcycle accidents, 20% are caused by dramatic or drastic falls, 15% as a result from an act of violence, and 14% are caused from a sports injury. The prognosis of such injuries truly relies on the location of the injury, as only a mere 6% of people who sustained a spinal cord injury to the lower regions die within the first year of their injury, whilst the fatality rate for the first year of a spinal cord injury sustained in the upper regions is 40%. So, injuries to the spinal cord often cause detrimental effects on sensation and movement to certain areas of the body. Paralysis is defined as a disruption of signals sent between the brain and the spinal cord due to injury. This may occur as sense is felt, but a signal from the brain cannot be adequately sent as a response, or simply that signals cannot be sent or received from both the spinal cord and the brain. And there are several different degrees of paralysis. Monoplegia occurs when one limb is paralyzed due to illness or injury. This means that function is lost only in a single limb, but sensation and movement can occur in all other unaffected limbs. This is most typically caused by strokes and tumors. Hemiplegia is similar to monoplegia, yet the paralysis is sustained in both an arm and leg on the same side of the body, so both the right arm and right leg are paralyzed. Function and sensation are typically felt elsewhere in the body, but not on these two limbs, and the most typical cause of this is cerebral palsy. Paraplegia is the result of paralysis below the waist, from the thoracic region down. This means that both the legs, hips, the groin, and bowel movements are all affected. People who are paraplegic often are within wheelchairs, although the severity as well as the ability for mobility relies on where the injury was sustained. Arms are often able to be used. Paraplegia is the result of a spinal cord infection or lesion, as well as traumatic injury. Quadriplegia, or tetraplegia as it is commonly referred to, is paralysis of the cervical region down. This includes paralysis of all four of the limbs and neck, as well as the torso. Quadriplegia function depends on the severity, yet movement is very difficult, and tetraplegia is caused most commonly by traumatic injuries such as car accidents, acts of violence, dramatic falls, and sports injuries. The cervical region of the spinal column contains 6 vertebrae. Cervical level injuries are generally the most severe and can cause the most dependency as they are the closest to the brain. Additionally, the higher up the body that the injury is sustained on indicates that more and more of the body below will be unable to function properly. As the cervical region is responsible for the movement of the head, neck, shoulders, hands, and arms, injuries sustained in this region often leave a person with tetraplegia. This is due to the muscles that the cervical region act upon, including the levator, scapulae, the trapezius, and the rhomboid muscles. Injuries to the fourth cervical vertebral region in particular can lead to very severe symptoms. Within the 8 pairs of nerves that make up the cervical region, a C4 injury indicates that damage was done to the supraclavicular nerve and all the nerve pairs below. The effects of such an injury include loss of diaphragm function, which may cause a patient to require 24-hour ventilators for breathing support. As they are quadriplegic, movement of the hands, arms, torso, and legs are all affected and compromised. Additionally, difficulties with the bladder and bowel system occurs as sensation and willing function are compromised. This type of injury is usually caused by severe trauma, such as an act of violence or a drastic fall, as well as from an infection or disease. The thoracic region of the vertebral column contains 12 vertebrae. The thoracic region is responsible for movement of the torso and trunk of the body as it connects to muscles such as the latissimus dorsi and the trapezius, both of which are responsible for moving the torso. An injury sustained to the 7th thoracic vertebral region, or a T7 injury, results in a person being paraplegic. Symptoms include loss of function in the legs and torso, a lack of ability to use fingers and hands, and a reduced ability to control the abdominal muscles. This results in the patient being in a wheelchair, depending on the severity of the injury or the treatment used. Additionally, bowel and bladder function is compromised. These injuries generally occur from trauma such as car accidents, infections, or birth defects. The lumbar region has 5 vertebrae. Lumbar region injuries tend to be less severe than cervical or thoracic region injuries as they are both farther down the body and easier to treat. The lumbar region, or L2 in particular, is responsible for the sensations in and on the anterior thigh. The muscle, iliopsoas, is utilized in activities such as walking up the stairs and is greatly affected and compromised by these injuries. This also affects both the groin and buttocks region. An L2 injury leads a patient to often be paraplegic and require a wheelchair. However, with lots of treatment, it is possible that these patients can walk using braces. Control of the bladder and bowel is still compromised, however. And additionally, these injuries are generally sustained by falls, birth defects, and often osteoporosis or degeneration. The spinal cord stops after L2, but from all of the vertebrae that follow it, nerve roots exit them through direct function. An S1 injury often affects the hip and groin regions, but people who sustain an injury to the S2 can often walk and drive with treatment and sometimes with support such as braces. Symptoms of such an injury include limited bladder and bowel control, lower back pain, leg pain that continues all the way down the backs of the legs, and sensory issues in both the buttocks and the groin. Treating a spinal cord injury can be extremely challenging as the nervous system is both incredibly complex and delicate. Nerve damage is very difficult to treat as nerves typically do not grow back. However, the lower the injury, the higher the probability of regeneration and regaining of function. There are several ways to treat spinal cord issues and injuries. Rehabilitating a person who has sustained an injury requires focusing on both the psychological effects as well as the physical effects, with the ultimate goal of figuring out ways patients can regain some degree of independence. To optimize function, several professionals from physical therapists, physiotherapists, and occupational therapists must focus on improving the quality of life of the patients. Stretching techniques, muscle strengthening exercises, and learning how to work around boundaries of said injuries are all subjects that are covered in treatment. However, in some severe cases, surgery may be required. The type of surgery depends on the severity of the injury that was sustained, but often a laminectomy is performed. This surgery works to remove the bony protrusions or coverings of the low spinal cord to work and move more freely, and this is called a decompression surgery. The spinal cord and the nervous system are both incredibly complex and extremely delicate. Information about both is still fairly scarce, but breakthroughs in new research is being conducted at increasingly positive rates. Hopefully, there will become a day when anyone who has suffered from a spinal cord injury can be treated and returned to optimal function. Thank you so much for listening to my presentation. I hope you have a great rest of your day.